A pharmacy residency is a postgraduate program that prepares pharmacists for clinical practice by providing experience in patient care and research. It helps build specialized skills and deepen clinical knowledge in a healthcare setting. In part 2 of this video series, we explore 17 pharmacy residency interview questions and answers. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, take time to research the residency program and review its focus areas so you can align your responses with the skills and values they prioritize. Don't forget to watch part 1 of this series. I have posted the link in the description below. Question number 1. What else do you think that I should know about you? This question gives you a chance to share something that hasn't been covered, something that could set you apart. Preceptors want to see how self-aware you are, what you value, and if there's a story or trait that reflects your character or potential as a resident. It also helps them understand your personality beyond your application. I think one thing worth mentioning is how committed I am to being a good teammate. In every rotation and job I've had, I've made a conscious effort to support others, whether that's staying late to help finish a project or stepping in when someone's overwhelmed. I know residency is intense, and I believe that having a strong team mindset really helps everyone succeed. I'm also someone who asks a lot of questions, not just to get things right, but because I genuinely want to understand how and why decisions are made. I think that kind of curiosity has helped me grow faster in clinical environments. Outside of pharmacy, I'm grounded, dependable, and focused. I believe that people do their best work when they feel respected and supported, and I try to bring that into every space I'm part of. If you're looking for someone who shows up fully and is always looking to contribute to the bigger picture, that's the kind of resident I'd be. Question number 2. Why do you think that you deserve the position? This question isn't just about confidence, it's about how well you understand the program, your own strengths, and how those two align. They want to see if you've reflected on why you'd be a good fit and whether you're truly ready for the demands of a residency. I don't think of it as deserving the position, but I do feel I'm ready to bring everything I have to this opportunity. I've taken on challenging rotations, pushed myself in clinical discussions, and worked closely with preceptors to develop sound judgment. I've learned how to stay calm when things get stressful, how to manage time carefully, and how to accept feedback without taking it personally. What draws me to this program is the strong preceptor support and the diverse clinical experiences. I'm looking for a place where I can grow, not just clinically, but professionally and personally. I'm not afraid of the hard days. I'm excited by them because I know those are the days where I'll learn the most. If you're looking for someone who's dedicated, teachable, and all in, I believe I bring that to the table. Question number 3. Describe what you do to keep up with the literature and tell me about a recent paper you've read or a presentation you have attended. Staying current is essential in pharmacy, especially for residents expected to make evidence-based decisions. This question helps assess whether you're actively engaged in lifelong learning and if you know how to apply what you learn to practice. I try to stay current by subscribing to newsletters like ASHP Daily Briefing and reading JAMA and AJHP regularly. I also follow clinical pharmacy updates through Reddit threads and Slack groups with past classmates and preceptors. We share interesting studies and case reports. Recently, I attended a presentation on managing GLP-1 agonists in patients with multiple comorbidities. It was a layered discussion, especially around dosing adjustments in CKD. It got me thinking more critically about real-world patient complexity beyond the textbook recommendations. One paper I read recently was about deprescribing PPIs in hospitalized patients. The study reinforced how often PPIs are continued long after their initial indication. It changed the way I approach MedRec and helped me feel more confident initiating conversations with providers about stopping unnecessary medications. I believe keeping up with literature isn't just about memorizing, it's about staying sharp and applying the best information for each patient in front of you. Question number 4. What was your most rewarding moment during your job, experience, rotation, etc.? Preceptors want to understand what motivates you and where you find meaning in your work. This helps them see whether your values align with their team and how you reflect on your past experiences. My most rewarding moment was during my internal medicine rotation when I worked with a patient who was confused about their new heart failure medications. The team was busy and he seemed overwhelmed, so I sat down with him after rounds and walked through each medication, why it was prescribed, what side effects to expect, and how to take it properly. He thanked me afterward and said it was the first time it had all made sense. Later, during follow-up rounds, he actually repeated back the instructions correctly and said he felt more confident managing things on his own. That moment reminded me how powerful clear communication can be, especially when someone's feeling vulnerable. It wasn't about doing something complicated. It was about making sure the patient felt seen and supported. That's the kind of pharmacist I want to be. Question number 5. What would your coworkers say about you? This question helps preceptors understand how you function on a team and what kind of presence you bring to a work environment. They want to know if others see you as reliable, supportive, and easy to work with, especially under pressure. I think my coworkers would say I'm reliable, steady, and someone who stays level-headed even when things get hectic. I've been told I'm approachable and that I ask thoughtful questions rather than jumping to conclusions. During rotations, preceptors often commented that I'm someone they could trust to follow through and who doesn't need to be micromanaged. I'm not someone who needs to be the loudest in the room, but I do try to be someone others can count on, whether that's covering a shift, helping double-check a complex med order, or just listening when someone needs to vent. In group settings, I try to keep things collaborative and productive, and I'm always happy to share resources or notes if someone's behind. I care about doing good work, but I also care about being a good teammate. Question number 6. Give me an example of a conflict you have encountered on your rotations and what you did to resolve that conflict. Residency programs ask this to understand how you navigate interpersonal challenges during high-stakes or stressful situations. Conflict is inevitable in healthcare, so they want to see emotional intelligence, professionalism, and a focus on resolution rather than blame. Your answer gives them insight into how you communicate, whether you escalate appropriately, and how you maintain patient-centered care even during disagreement. During one of my hospital rotations, I had a disagreement with a nurse regarding the timing of a vancomycin trough level. She felt the blood draw should occur at a different time than what was recommended based on the medication's administration and half-life. Instead of arguing, I asked if we could quickly go over the medication chart together and talk through the timing. I explained the rationale using pharmacokinetics and showed how an inaccurate trough would impact dosing decisions. We ended up agreeing on a compromise to adjust the administration time slightly to align better with their workflow while still capturing a valid level. That small adjustment helped improve collaboration moving forward. The situation reminded me that communication is often more powerful than credentials. Everyone on the team brings different knowledge and concerns, and the best outcomes come when we slow down and actually listen to each other. It wasn't about winning, it was about doing what was safest for the patient. Question number 7. Some of your preceptors will not have pharmaceutical degrees. Do you have any issues taking directions from someone with a lesser degree? This question tests for humility and your ability to be a team player. In residency, you'll work with physicians, nurses, administrators, and technicians, some of whom may guide you in non-clinical areas. Hiring managers want to know that you can take constructive feedback regardless of someone's credentials, and that you don't let ego get in the way of growth or collaboration. I don't have any issue taking direction from someone who doesn't hold a pharmacy degree. Healthcare is team-based, and every professional brings their own expertise to the table. I've learned valuable lessons from nurses, case managers, and even pharmacy technicians, especially when it comes to workflow, patient communication, and operational insight. During one rotation, a nurse showed me how she handles med reconciliation during patient interviews. Her approach was incredibly effective, and I've used that method ever since. I made sure to thank her and later shared the technique with other students. As long as the feedback or direction is given with the patient's well-being in mind, I'm open to learning from anyone. I see residency as a chance to become more well-rounded, not just clinically, but interpersonally too. Respecting everyone's contribution is key to being successful in a clinical setting. Question number 8. Give me an example of a leadership project or position you have been in. Residency programs are looking for pharmacists who can lead projects, influence others, and show initiative. They want to see whether you've taken on responsibility outside of your regular duties and how you motivated others toward a common goal. It also shows how well you manage planning, delegation, and follow through. During pharmacy school, I served as the president of our student chapter of AMCP. One of our main goals that year was to boost engagement and educate students about managed care career paths. I led a project to organize a multi-campus virtual panel with pharmacists from health plans, PBMs, and industry roles. I coordinated outreach to the speakers, handled event promotion, and worked with our faculty advisor to align the panel with curriculum topics. I also delegated tasks to team members, like managing the event platform and creating a post-event survey to gather feedback. Over 120 students attended across 2 campuses, and we received really positive responses. A few attendees even said it helped them decide on their post-grad path. It was one of those moments where I felt proud not just because the event went smoothly, but because the team worked well together and it actually made a difference for people. Question number 9. Give me an example of a team situation you have worked in. What was your role within the team, and did you experience any conflicts? Residency is all about collaboration, so interviewers want to hear how well you function in team settings. They want to know how you communicate, what role you naturally take, and how you respond when the team hits a bump. This also shows whether you're reflective about your role and can navigate group dynamics professionally. During a group project in my final year, we were tasked with developing a formulary proposal for a mock P&T committee. I took on the role of organizing the research and assigning key deliverables because I tend to be good at keeping things structured. At first, everything went smoothly, but halfway through, one team member started missing deadlines without letting anyone know. Rather than calling them out in front of the group, I checked in with them privately. It turned out they were dealing with a personal issue and felt overwhelmed. We rebalanced the workload and extended one of our internal deadlines. After that, the team functioned much better, and the final presentation was well received. That experience taught me how important it is to check in and not assume the worst. In team settings, communication and flexibility are key. Everyone brings different strengths, but we all have off days, and a little support can keep the group moving forward. Question number 10. What was your favorite non-pharmacy job and why? This question gives insight into how you work in team settings, handle responsibility, and what you value in a job, even outside of pharmacy. Hiring managers are looking for transferable skills like communication, work ethic, or leadership, and how they apply to your interest in pharmacy. My favorite non-pharmacy job was working as a barista in college. It was a busy, high-pressure environment where you had to stay organized, communicate clearly with teammates, and serve customers with a positive attitude. It taught me how to multitask under stress, which is a skill I've definitely brought into the pharmacy world. What I liked most was the regular interaction with customers and the ability to brighten someone's day through small gestures. It helped me get comfortable initiating conversations and resolving misunderstandings, skills that translate directly into patient counseling and working with multidisciplinary teams. That experience showed me that even in fast-paced roles, relationships and attention to detail make a big impact. I didn't realize it at the time, but that job helped shape my communication style and helped me learn how to read people's needs quickly, which I now apply in clinical situations. Question number 11. What was your favorite and least favorite rotation and why? This helps assess your self-awareness and shows what areas of pharmacy you're drawn to or find challenging. Programs want to understand your clinical interests, but they also want to see if you reflect constructively on growth areas, not just avoid them. My favorite rotation was in internal medicine. I really enjoyed being part of a team where I could make daily recommendations and follow up with patients throughout their stay. I liked reviewing labs, adjusting therapies, and seeing the impact of our interventions over time. It made me feel like I was a real part of the care team, and I appreciated how receptive the physicians were to pharmacist input. My least favorite was community pharmacy. While I respect the role it plays in public health, I found it hard not being able to follow up with patients in a deeper way. I enjoy solving clinical problems, and I miss the opportunity to engage with broader medication management. That said, I gained a better understanding of patient barriers, like affordability and access, and how important communication is, even in short interactions. Both rotations taught me valuable lessons, and I believe having a range of experiences helps me stay well-rounded and patient-focused. Question number 12. We all have to bend the rules at one time or another. Give me an example of when you had to bend the rules and how you handled the situation. This question explores your judgment and ethics. Hiring managers want to know if you understand the balance between policy and patient care and whether you think critically rather than blindly following or breaking rules. It's about how you handle gray areas with accountability. During one of my rotations, a patient was being discharged with multiple new prescriptions, including one high-cost medication that wasn't covered by their insurance. The discharge nurse was ready to send the patient home, but I knew they wouldn't be able to afford it and would likely go without. While protocol said to go through formal prior authorization channels, I reached out directly to the prescriber and suggested a therapeutic alternative that was on the patient's formulary. We got verbal approval and documented it immediately, which helped avoid a delay in discharge. Technically, I bypassed the usual approval route, but I made sure to inform the attending and document the change to stay compliant. I felt it was the right decision in the moment to prevent a gap in therapy. It taught me that bending the rules can be necessary, but it needs to be done with transparency, collaboration, and patient safety as the priority. Question number 13. Give me an example of an instance where you disagreed with how the team handled a specific problem and how you handled the situation. This question helps hiring managers evaluate how you handle conflict, advocate for your viewpoint, and whether you can maintain professionalism even when you disagree. They want to know that you can speak up respectfully and work through team dynamics. During a cardiology rotation, the team was managing a patient with new onset atrial fibrillation, and the plan was to discharge with warfarin without bridging, despite the patient having several risk factors for stroke. I felt the decision was too risky, so I brought it up during rounds. Rather than pushing back forcefully, I asked questions to better understand their reasoning and then presented guidelines and patient-specific factors to support my concern. It turned out they had overlooked a recent renal function change that made bridging more appropriate. The plan was adjusted, and the patient was safely discharged with a new strategy. I learned that disagreeing doesn't have to be confrontational. If you lead with curiosity, support your view with evidence, and approach it as a shared goal, teams are much more open to listening. Patient safety is always worth speaking up for. Question number 14. Tell me why I should choose you over your peers for this residency. Programs ask this to see how well you understand your strengths and how you'll contribute to their team. They're looking for confidence without arrogance and a clear sense of how your skills, attitude, and experience make you a valuable fit for their program. I know you'll interview a lot of qualified candidates, but I believe what sets me apart is how consistently I show up prepared, positive, and focused on growth. I'm not just passionate about pharmacy. I'm committed to improving patient care in real, measurable ways. Whether it's following up on a lab result, clarifying an order, or educating a patient, I take ownership of the details that make a difference. I'm also someone who thrives in team settings. I listen well, ask good questions, and value feedback. In my rotations, preceptors have commented on my curiosity and my ability to adapt quickly without losing sight of patient safety. This residency would give me the chance to build on those strengths while pushing myself in new ways. I'm not here just to meet expectations. I'm here to grow into a clinical pharmacist who contributes meaningfully to both patient outcomes and the pharmacy team. Question number 15. Why have you selected this institution? And what do you think you will bring to our program? Program directors want to know that you've done your homework and aren't just applying broadly. They're looking for a good mutual fit, someone who understands their strengths, values, and learning environment. They also want to hear what unique traits, skills, or perspectives you can bring that will enhance the residency cohort. This helps them assess both your preparation and your long-term value to the program. I selected your program because it aligns with the kind of pharmacist I want to become: well-rounded, clinically sharp, and team-oriented. Your strong emphasis on interdisciplinary care, especially in internal medicine and ambulatory care, caught my attention. I also appreciate that your preceptors are highly involved and that residents are treated as integral members of the care team. That kind of mentorship and responsibility is what I'm looking for. What I bring is a strong sense of initiative and a deep commitment to patient care. During my APPE rotations, I was often the one to stay late to help with medrecs or follow up on clinical interventions. I don't mind putting in the extra time because I see every challenge as a learning opportunity. I also bring strong communication skills. I've had experience counseling diverse patient populations, and I enjoy bridging gaps between patients and providers. I want to contribute to the team from day one and grow into a resident who adds real value. Question number 16. Where do you see yourself in 5 years? How about in 10 years? This question helps program directors assess your level of focus and how residency fits into your career vision. They aren't looking for a perfect roadmap. They're looking for clarity in your goals and whether you understand the stepping stones needed to get there. Your answer also shows if you're open to growth and leadership within the profession. In 5 years, I see myself as a clinical pharmacist working in a hospital or academic medical center where I can be part of a multidisciplinary care team. I'd like to be precepting students or residents by then, passing on what I've learned and staying involved in professional development. I enjoy teaching, and I want to keep growing in a way that supports others too. In 10 years, I'd love to be in a leadership role, whether that's managing a clinical team or contributing to program development within a health system. I'm also interested in health equity, so being part of initiatives that improve access to pharmacy services in underserved communities would be really meaningful to me. Residency is the next step that helps bridge where I am and where I want to go. I know there's still a lot to learn, but I'm excited for the challenge and the structure that residency offers to help me build toward those goals. And finally, here's the last question. Question number 17. What questions do you have for me? Quick note, sometimes this question can be asked at the beginning of an interview by a program director. Make sure you are prepared with some relevant questions. When program directors open with this, it's a test of your preparedness and curiosity. They want to see if you've thought seriously about the program and if you're engaged enough to ask thoughtful, meaningful questions. It's also a chance for them to hear what matters most to you as a candidate, whether it's mentorship, clinical experience, or work-life balance. I actually do have a few questions I've been looking forward to asking. First, I'd love to hear your perspective on what makes a resident in this program really stand out. What qualities or actions set someone apart? I'd also like to know how the program supports residents when they're navigating uncertainty, whether that's a challenging clinical scenario or finding their niche during the year. What's the mentorship structure like in those moments? Another area I'm really interested in is the relationship between pharmacy and the other disciplines here. What are some ways residents are actively involved in team-based care, and how receptive are providers to pharmacy input? And one last thing, what do you personally enjoy most about working with residents? I think that kind of insight says a lot about the culture of the program, and it's something I really value when considering where I'll be spending such a formative year. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.